If you're over 60 and you're not waking up with morning erections anymore, I need you to listen to what I'm about to share. 3 months ago, a 67-year-old patient sat in my Toronto clinic, and I could see he'd been crying. His marriage was hanging by a thread. Today, his wife calls me every few weeks just to say thank you. What changed? 4 specific exercises that I've been using with over 300 patients right here in Ontario, and some of them started seeing improvements in just 2 weeks. I'm Dr. Emily Carson, and I've been a urologist here in Canada for more than 15 years. I've worked with men from Vancouver to Halifax, from guys in their early 60s, right up to their late 70s. And what I'm going to share with you today isn't some miracle core you'll find on those late night infomercials. These are the exact same exercises I use with post-surgical patients at the hospital. The same protocols I'd recommend to my own father if he needed them. Now, before we dive in, I want you to understand something. If you're experiencing erectile difficulties after 60, you're not alone. It's not just about age, eh? It's about what's happening inside your body, and more importantly, what we can do to fix it. You might have tried those little blue pills. Maybe they worked for a bit, but they're not addressing the root cause. You're just putting a bandage on the problem. Here's what's really going on. As we age, the pelvic floor muscles weaken. Blood flow decreases. The tissues lose elasticity. But here's the good news, and I mean really good news. Your body has an incredible ability to rebuild and strengthen. Even after 60, even after 70, even after prostate surgery. I've seen it happen hundreds of times in my practice. So here's what we're going to cover today. 4 exercises that'll retrain your body naturally. No medications with weird side effects. No expensive procedures. No embarrassing situations. Exercise number 3 is particularly powerful, and I'll explain exactly why when we get there in about 8 minutes. But first, let me tell you about Robert. Robert came to see me when he was 67. He'd had prostate cancer surgery 2 years prior, and things hadn't been the same since. He felt like less of a man. His confidence was shot. His relationship with his wife of 40 years was suffering. Sound familiar? Now, I'm not going to sugarcoat it. I told Robert this would take work, 4 to 6 weeks of consistent effort. But he committed, and you know what? After just 3 weeks, he noticed changes. After 2 months, his wife noticed changes. After 4 months, he told me he felt like he was 50 again. And Robert's not special. He's not some exception. I've got dozens of success stories just like his from right here in the GTA and across Canada. Men who thought their intimate life was over, who'd given up hope, who were too embarrassed to even bring it up with their doctor. But they took action, and their lives changed. All right, let's get into the 4 exercises. Now, I want you to grab a pen and paper, or if you're watching this on your phone, get ready to take some screenshots, because what I'm about to share is going to be detailed. Don't worry about remembering everything. I'll put timestamps in the description below so you can come back to any section. Exercise number 1, and this is the foundation everything else builds on, is Kegel exercises. Now, I know what you're thinking. Doc, aren't those for women? Absolutely not. Kegels are one of the most powerful tools we have for men's pelvic health, and here's why they work so well. Your pelvic floor muscles control everything down there. Urinary function, erectile function, even the strength of your orgasms. When these muscles are weak, everything suffers. When they're strong, everything improves. Here's how you do them properly, because most guys I see are doing them wrong. First, you need to find the right muscle. Next time you're taking a pee, try to stop the flow midstream. That squeezing sensation, that's your pelvic floor muscle. But don't make this a regular practice during urination. We're just using it once to identify the muscle. Got it? Good. Now here's the actual exercise. Sit comfortably in a chair, both feet flat on the floor. Take a normal breath, and as you breathe out, squeeze that pelvic floor muscle. Hold it for 5 seconds. You're not tensing your abdomen. You're not clenching your buttocks. You're not tightening your thighs. Just that internal muscle. It should be subtle but controlled. Then release slowly for 5 seconds. That's 1 repetition. Start with 10 repetitions 3 times a day. Morning, afternoon, evening. Set reminders on your phone if you need to. After a week, increase the hold time to 8 seconds. After 2 weeks, go for 10 seconds. The goal is to work up to 10-second holds, 15 repetitions 3 times a day. I know it sounds like a lot, but each session only takes about 3 minutes. You can do them while you're having your morning coffee, watching hockey night in Canada, or sitting in traffic on the 401. Now here's where most guys mess up. They squeeze too hard, they hold their breath, they tense everything. Don't do that. This should be controlled and isolated. Think quality over quantity, eh? And here's a big one. You need to be consistent. Doing 30 reps once a week won't cut it. It's like going to the gym once a month and expecting to build muscle. 3 times a day, every day, for at least 4 weeks. What can you expect? Most men start noticing stronger erections after 3 to 4 weeks. Better urinary control usually shows up sooner, often within 2 weeks. And here's a bonus a lot of guys don't expect: more intense orgasms. That's because you're strengthening the muscles that contract during climax. All right, exercise number 2, reverse Kegels. Now, stay with me here because this one's a bit more advanced, but it's absolutely crucial. While regular Kegels strengthen the contraction, reverse Kegels train the relaxation, and you need both. Think of it like this: if you only ever flexed your bicep and never relaxed it, you'd have problems, right? Same principle applies here. Here's how you do a reverse Kegel. Instead of squeezing and lifting, you're going to gently push down and relax. It's the same sensation as when you're trying to urinate a bit faster, or when you're having a bowel movement, but again, we're doing this as an isolated exercise, not during actual bathroom activities. Sit or lie down comfortably. Take a deep breath in, and as you breathe out, gently bear down, like you're trying to push something out, but very gently. Hold this for 5 seconds, then relax for 5 seconds. Start with 5 repetitions once a day. After a week, increase to 10 repetitions. Why is this important? A lot of men with erectile difficulties have overly tight pelvic floors. It's counterintuitive, but too much tension down there can restrict blood flow and make erections harder to achieve or maintain. Reverse Kegels teach your body to relax on command, which is essential during intimate moments. Combine regular Kegels with reverse Kegels, and you're training both strength and flexibility. It's like having a muscle that's both powerful and supple. That's the sweet spot we're aiming for. Now, exercise number 3, and this is the one that's made the biggest difference for my post-surgical patients, is vacuum therapy, or as some people call it, the penis pump. I know, it sounds intimidating, and maybe you've seen these advertised in questionable places, but let me be clear. This is legitimate medical equipment. We use these in hospitals after prostate surgery to help restore function. They're FDA and Health Canada approved. Here's how it works. The device creates a vacuum around the penis, which draws blood into the tissue. This increased blood flow does 3 things. First, it gives you an immediate erection while using the device. Second, with regular use, it helps maintain tissue health and elasticity. Third, over time, it can actually improve your natural erections by keeping those blood vessels in good shape. Now, I'm going to be straight with you about where to get one because this is the question I get asked most often. You can find medical-grade vacuum devices at most pharmacies here in Canada, Shoppers Drug Mart, Rexall, even online through Amazon.ca. Look for brands like Encore, Vaxaid, or Postivac. You're looking at somewhere between $300 and $600 Canadian, depending on the model. Yes, that's an investment, but consider this. Those little blue pills run you about $15 to $30 each time. This is a one-time purchase that'll last you years. Here's how to use it safely and effectively. First, if you've had prostate surgery or any pelvic surgery, check with your doctor before starting. Usually you'll get the green light after 6 to 8 weeks of recovery, but don't just take my word for it. Confirm with your surgeon. Start by applying a water-based lubricant around the base of the penis where the cylinder will seal against your body. Insert the penis into the cylinder, then activate the pump, either manual or battery operated, depending on your model. Slowly create a vacuum. You should feel a pulling sensation, but it shouldn't be painful. If it hurts, you're pumping too much air out. Once you've achieved an erection inside the cylinder, hold it there for about 2 to 3 minutes. Then release the vacuum slowly. That's 1 cycle. Rest for 1 minute, then repeat. Do 3 to 4 cycles per session. I recommend doing this daily or every other day. For guys who've had prostate surgery, this exercise is especially important because it helps prevent tissue shrinkage and scarring. It's like physiotherapy for your penis, eh? And I've had patients who were told they'd never have natural erections again after surgery. And after 6 months of consistent vacuum therapy combined with Kegels, they're having spontaneous morning erections again. One important note, if you're using the vacuum device for intimate activity, there are tension rings that go with it to maintain the erection once you remove the pump. That's perfectly fine for that purpose. But for daily exercise and rehabilitation, you don't need to use the rings. We're just focusing on bringing blood flow to the area. Exercise number 4 is cardiovascular exercise. Now I know you might be thinking, Doc, how's going for a walk going to help my erection? But hear me out, because this is more important than most guys realize. Erectile function is fundamentally about blood flow. When your cardiovascular system is healthy, blood flows easily throughout your entire body, including where you need it most. Studies show that just 30 minutes of moderate aerobic exercise, 3 to 4 times a week, can significantly improve erectile function. We're talking about walking, cycling, swimming, even shoveling snow here in Canada. Anything that gets your heart rate up and keeps it there for a sustained period. Here's why this works. Aerobic exercise improves the health of your blood vessels. It reduces inflammation. It helps manage blood pressure and cholesterol, both of which are major factors in erectile difficulties. It also boosts testosterone naturally and improves your mood and energy levels. All of these contribute to better sexual function. The good news is, you don't need to become a marathon runner. A brisk 30-minute walk around your neighborhood is enough. And if you're in the GTA, like many of my patients, walking through High Park or along the waterfront, getting some fresh air and sunshine, that's perfect. If you're somewhere colder like Winnipeg or Edmonton, even mall walking works great during those brutal winter months. Start where you are. If you can only manage 10 minutes right now, that's fine. Do 10 minutes. Next week, try for 12 minutes. Build up gradually. The key is consistency. 3 to 4 times a week, every week. Put it in your calendar. Treat it like a doctor's appointment, because in a way it is. Now, let me address something specific for those of you who've had prostate cancer surgery. I know that comment section is going to have questions about this, because I see it in my practice every single day. Guys who've been through the surgery, they're worried. They've been told things might never be the same. And I'm not going to lie to you. Recovery after prostate surgery is different for everyone. But here's what I can tell you from 15 years of experience. The men who commit to pelvic floor rehabilitation, who use vacuum therapy consistently, who take care of their cardiovascular health, they have significantly better outcomes. Not just compared to doing nothing, but often compared to what they were told to expect. After prostate surgery, you need to start the rehabilitation as soon as your surgeon gives you clearance, usually around 6 to 8 weeks post-op. Start with Kegels immediately. They'll help with urinary control too, which is often a concern after surgery. Add the vacuum therapy once you're cleared. Even if you're not seeing results right away, you're preventing tissue damage and scarring. You're maintaining elasticity and blood flow. I had a patient, David, 72 years old, post-prostatectomy. He started these exercises at 8 weeks post-op. By month 4, he was getting some erectile response. By month 6, he could achieve erections sufficient for intimacy with the help of medication. By month 10, he was having natural erections, no medication needed. That's not typical for everyone, but it shows what's possible with dedication. The timeline for post-surgical recovery is longer. You're looking at 6 months to a year, sometimes up to 18 months. But every bit of function you regain is worth it. And even if you don't regain full function, improved blood flow and tissue health means better outcomes with medications or other treatments. All right, let's talk about the 3 most common mistakes I see guys making with these exercises. Number 1, inconsistency. You do Kegels for a week, don't see immediate results, and give up. Guys, this isn't a light switch, it's more like planting a garden. You need to water it daily, give it time, and trust the process. Commit to at least 8 weeks before you judge whether it's working. Mistake number 2, doing the exercises incorrectly. I can't tell you how many men come to see me and say, Doc, I've been doing Kegels for months and nothing's changed. Then I watch them do one, and they're tensing everything from their abs to their toes. That's not a Kegel. That's just random muscle clenching. If you're not sure you're doing it right, ask your doctor to refer you to a pelvic floor physiotherapist. Yes, they exist specifically for men, Yes, it's worth it. Mistake number 3, expecting exercises alone to fix everything when there are underlying health issues that need addressing. If you've got uncontrolled diabetes, high blood pressure that's not being managed, you're 30 pounds overweight, you're smoking a pack a day, these exercises will help, but they're not magic. You need to address those other factors too. Think of it as a comprehensive approach. The exercises are crucial, but they work best when your overall health is in good shape. So, what's the realistic timeline? Here's what to expect if you're doing everything right. In weeks 1 and 2, you might not notice much. Maybe some improved urinary control, maybe feeling more aware of your pelvic floor. Don't get discouraged. Things are happening at a cellular level, even if you can't feel it yet. Weeks 3 to 4, this is where most guys start noticing changes. Erections might be slightly firmer. You might wake up with morning wood once or twice, even if it's been years. Small victories, but they're meaningful. Months 2 to 3, you should be seeing more consistent improvements. Erections are noticeably stronger and last longer. You've got better control. Confidence is coming back. Your partner's probably noticing too. Month 4 and beyond, this is where things stabilize. You've built a strong foundation. The exercises become habit. Your function is significantly better than when you started. For some guys, it's 70 to 80% improvement. For others, maybe 50%. But that 50% makes a huge difference in quality of life. Now, I want you to do something for me right now. If you're committed to starting these exercises today, leave a comment below. Just write 4 weeks. That's it. No need to share personal details. I know this is private. But that simple act of typing it out and making that commitment publicly, even anonymously, it increases your follow-through rate dramatically. So go ahead, pause the video, scroll down, type 4 weeks in the comments. And if you found this helpful, hit that like button. Share this video with someone who needs it. Maybe send it privately if they'd appreciate that. These are conversations men don't have enough, but they need to. You're not alone in this, eh? There are thousands of guys right here in Canada dealing with the same thing. Subscribe to the channel because I'm making a follow-up video specifically about nutrition and supplements that support erectile function. Things like L-arginine, citrulline, what actually works, and what's just marketing hype. I'm also going to do a detailed video on post-prostatectomy rehabilitation with specific timelines and expectations. If you want to see those, let me know in the comments. Look, I've been doing this work for 15 years, and I can tell you this. The men who take control of their health, who put in the work, who don't just accept that's how it is at your age, they're the ones who maintain their quality of life, their relationships, their confidence. You deserve to feel good. You deserve to have an intimate life that's fulfilling. And with these 4 exercises, you've got a proven path forward. Start today. Exercise 1, those Kegels. Do your first set right after this video. Exercise 2, reverse Kegels. Add those in next week. Exercise 3, if you need the vacuum device, order it this week. Exercise 4, cardio. Go for a walk today. Even just 10 minutes, small steps lead to big changes. And remember, if you're dealing with this after prostate surgery, don't lose hope. I've seen men in their 70s recover function they thought was gone forever. It takes longer, it takes patience, but it's possible. Check with your doctor, get clearance, and start the work. Your future self will thank you. Your partner will thank you. And honestly, your overall health will improve too. These exercises don't just help with erectile function. They improve urinary control, core strength, even help prevent falls as we age. You've got this. I believe in you. Now get started.